Hi, I'm Dr. Cameo Carter. Thanks for joining me again. At the end of the day today, I'm angry, truly angry. And beneath that anger, I'm tired. Tonight, though, the anger comes first because I'm so tired of watching people in positions of power undermine the health of our children, undermine public trust in medicine, and undermine the professionals who have dedicated their lives to caring for families. This week, that anger hit a nerve when I saw an interview with Dr. Oz, who is currently the administrator of the Center for Medicare and Medicaid Services, one of the most powerful health leadership positions in this country. During this interview, he described a story about a physician in training who refused to speak with a teenager alone without their parents in the room. And instead of correcting that trainee's misunderstanding of adolescent care, instead of educating the public on why confidential time with teens is standard medical practice, he praised it. And then he used language suggesting that what pediatricians do when we speak with adolescents privately is somehow grooming. I need to say this clearly because there should be no ambiguity. This is outrageous. This is false, and it's dangerous. Speaking to adolescents privately is standard of care. This is not fringe medicine. This is not political. This is not an ideology. This is pediatrics. This is what we're trained to do. When children enter preteen and teen years, typically middle school and certainly by high school, it is medically appropriate and developmentally important to spend part of the visit speaking with them just one-on-one. In my office, we begin this in high school, in 9th grade. This is where we begin teaching them what the doctor-patient relationship means. This is where we help them start taking ownership of their health. And yes, this is where we ask about private issues: depression, anxiety, self-harm, substance use and abuse, sex, sexuality, gender questions, safety, relationships, abuse, bullying, sleep, stress, things that can be deeply personal and sometimes life-threatening. And yes, sometimes those things a teenager does not want to say in front of their parent. And that's okay. Actually, you know what? It's more than okay. It's normal. It doesn't mean that there's something wrong with the parent-child relationship. It means the child is becoming an adolescent. It means they're developing autonomy. That is literally part of healthy development. I can't tell you how many times a teenager says, "I'm fine," while sitting next to a parent. And then once the door closes, they look at me and say, "I think I'm depressed," or "I've been vaping. I'm having sex and I don't know what to do. I think I might be pregnant. I don't feel safe with my boyfriend or girlfriend. I've been thinking about hurting myself." Making space for those moments literally saves lives. That private time isn't some side note in the visit. It is often the most important part of the visit. So when someone in one of the highest healthcare leadership roles in this country uses the word grooming to describe that, it's infuriating because words like that are inflammatory. It's language chosen to provoke fear, disgust, distrust. And when you use that kind of language about standard pediatric care, you're not just insulting physicians. You're actively eroding trust between families and the people trying to keep their children safe. And I'm angry because children are the ones who continue to pay the price. The teenager who was going to tell their pediatrician that they're suicidal may now stay silent. The teen who is going to disclose abuse may now say nothing. The teen who desperately needs help with depression, anxiety, or substance use may never speak up because now the family is afraid. Now the parent is suspicious. Now the physician is being framed as the problem. This is what makes it so dangerous. And truly, this part is a part of a larger pattern that is exhausting. It feels like this administration continues to do things that undermine health, undermine trust in science, undermine evidence-based medicine, undermine the people who have dedicated their lives and careers to service. Pediatricians, nurses, therapists, teachers, librarians, mental health professionals, public health workers, people who show up every day for children and families. It is profoundly demoralizing to spend your life training to protect children and then have the work you do twisted into something sinister. We are already fighting so much. Insurance denials, prior authorization, mental health crises, school support failures, public health misinformation, burnout, workforce shortages. And then on top of that, we have to defend the most basic standards of care from people who should be supporting them. And that's where the tiredness also comes in. Because the anger is sharp. Underneath it is this feeling of, why do we have to keep defending the basics? Why do we keep having to explain that asking a teenager privately if they're safe is not grooming? Why do we keep having to defend life-saving pediatric care? It is exhausting. But I refuse to let this language and language like this go unanswered, because this is about our kids. This is about their safety. This is about their right to have a trusted relationship with their physician. This is about protecting the integrity of pediatric medicine. And at the end of the day, this is not grooming. This is how we catch depression. This is how we identify abuse. This is how we prevent tragedies. This is how we help adolescents grow into healthy adults. This is pediatrics. And I will continue to defend it loudly every single time. So tonight, my ask is really simple. Do not stay silent when misinformation threatens the health of our children. Share this conversation. Talk to your pediatrician. Talk to other parents. Push back on rhetoric that undermines evidence-based care. Our children need trusted adults willing to protect both their physical and mental health. And those of us in medicine need to keep using our voices, especially when the basics of good care are being attacked. At the end of the day, children deserve better than fear-based narratives. They deserve honesty. They deserve safety. They deserve good medicine. And as long as I have a voice, I will keep advocating for them. Again, I'm Dr. Cameo Carter. And at the end of the day, we just keep showing up for our kids.